Hi folks, Dr. Ed Byer. Today we're discussing different causes of female hormone imbalances, and one of them is endocrine disruptors, what I call the X factor in difficult hormone cases. These are chemicals that are found in our environment that really impact or affect the way our hormones react in our body. And look folks, we live in an environment today that's just loaded with these chemicals. So I'm telling you, a lot of my patients, this is a problem, and it has to be addressed. So some of them you can't avoid entirely, but if you can minimize them or keep the liver working really well so it can detox them, it makes a huge difference in the lives of a lot of female patients that I see. So endocrine disruptors, they're also known as endocrine disruptor chemicals, or EDCs. There's a lot of information on this in the internet. You can go to the Environmental Working Group website, www.ewg.org, and learn more about these chemicals for those of you who like to learn this stuff, like me. So anyhow, these are common chemicals that affect our body. How do they affect our body? They increase the production of certain hormones. They decrease the production of other hormones. They turn one hormone into another. That doesn't sound very good. They interfere with hormone signaling, which is the hormone attaching to a receptor site. Remember, a hormone by itself does nothing. It has to be like a lock and a key, has to fit onto a receptor site, and these chemicals disrupt that in a lot of people. They bind to essential hormones, making them ineffective. They can accumulate in organs that make hormones, like our thyroid gland is very susceptible to toxins and these endocrine disruptors. And they can raise the metabolic set point on people, making it almost impossible to lose weight. These are called obesogens. All right, so I want to cover 6 of them today. One of them that a lot of people have heard of is called Bisphenol A, or BPA. This is a chemical used in plastics, and it imitates estrogen. So when we're exposed to these, we get extra estrogen. That's called a xenoestrogen, a chemical that has an estrogen-like effect in the body. So it's linked to reproductive problems, breast cancer, obesity, early puberty, heart disease. This is like plastics, or plastics that get heated up, like in your car. You got a bottle of water, it gets heated up. Plastics on the covering of receipts that we get from the store. So and we can test for these to see if your body's making antibodies to it. Dioxins are everywhere, they're ubiquitous, and you really can't avoid all of them. But we teach our patients how to avoid many of them. They're formed in many industrial processes. If we lived in Fiji or Tahiti, maybe it's not a problem. But we live here in the Chicagoland area, or any industrial area, you're going to be exposed to these every day. These interfere with that signaling, the hormone to a receptor site, and they're powerful carcinogens. So we try to minimize these. We teach our patients how to minimize them, and we keep the liver going well, so the ones that do get in, we can get rid of. Atrazine, this one's my favorite because they found that atrazine turned male frogs into female frogs because of how much estrogen effect it has on males. It's an herbicide used in almost all corn products. So if you're not eating organic corn, you're getting atrazine in your body, and it has an estrogenic effect. And if you know anything about all the female cancers, most of them are related, most of them are estrogen receptor positive, and so it's a big problem. Estrogens are everywhere, and estrogen-like compounds called xenoestrogens are everywhere, and atrazine is a very powerful one, linked to breast cancer, prostate inflammation, and the aim here is to really use bioorganically, and filter your water. All right, number 4, phthalates. These are linked to obesity, diabetes, and low thyroid. The thyroid gland is really susceptible to these endocrine disruptors and toxins in our environment. It's found in plastic food containers, children's toys. In fact, they've had to label their toys, like label number 3. Personal care products, we should be reading labels if you really want to get down to the underlying cause of the hormone imbalances. Fragrance is a catch-all term for phthalates. When you see natural fragrance, that could be a phthalate, okay? Number 5, perchlorate. This is in rocket fuel, but it's also found in produce, milk, and drinking water. This competes with iodine going into the thyroid, so it really disrupts thyroid regulation. And remember, thyroid is a major player when it comes to regulating our other hormones too. Fire retardants. If you've ever bought a new piece of furniture or a new mattress or a new carpet and you smell that smell, that's a fire retardant, okay, known as polybrominated diphenyl ethers, okay? Say that 3 times real fast. This disrupts thyroid, but it's been doubling in breast milk since 1972. And so, these are things that we can avoid or make sure we let them air out our new furniture, our carpet, before we actually go into the room. But mainly we want to keep the liver working well, minimize the exposure as much as possible, keep the liver going. But these disruptors are absolutely always a piece of the puzzle when it comes to regulating hormones. I'm Dr. Byer. I hope that helps.